Have you ever had pubic pain or pain in your crotch while you're pregnant or postpartum? Today we're going to dive into everything pubic symphysis dysfunction. As a chiropractor, this is something I see often with a lot of my pregnant and postpartum patients, but what exactly is it and how do we treat it? First, let's talk about exactly what pubic symphysis dysfunction is and what is a pubic symphysis. So the pubic symphysis is where your pelvis bones meet in the front, and there is a joint there that normally doesn't move. It's pretty stationary. However, when we're pregnant, things start to soften in that joint so it can start to separate out and make room as you grow and for baby to come out during labor. Sometimes with increased pressure during pregnancy, we can start to get dysfunction in this area with movement that's not supposed to be there, and it can turn into pain. The other thing we'll see a lot of is instability. Now, who's most likely to experience this kind of pain? Well, it can affect pregnant women, usually in their second and third trimester, and it can also affect women postpartum after they've given birth. While it can occur for various reasons, let's talk about risk factors that can make it more likely. First, hormonal changes. Pregnancy hormones like relaxin help our ligaments relax, hence the name, so we can in fact grow and the pelvis can widen so you can give birth. However, this can make the pubic symphysis and other joints more likely to have instability and to develop pain. We can also have increased pressure. As your baby grows, especially as they get into the head down position, it can put added pressure on these joints, especially that pubic symphysis, which can again lead to that instability and pain. If you've had previous trauma, you are more likely to develop pain if you're pregnant or postpartum in this area. Anything like blows to the pelvis, car accidents, those sorts of things can make you more susceptible to this kind of pain. If you've had multiple pregnancies, this can also lead to increased pain as the ligaments are already kind of stretched out, and especially if those pregnancies are close together, your body might have not had the chance to completely 1000% recover from the pregnancy prior, and you have a little bit of a looser ligament structure than you would have if you hadn't been pregnant before. Now let's get to the good stuff. How do you treat it? As a chiropractor, I'm a huge advocate for non-invasive drug-free options. So let's talk about some of them. Of course, number one, chiropractic care. Specifically someone who works with pregnant women and postpartum women. Look for certifications like Webster Technique, women who have taken ICPA courses, and things like that, as they are more likely to have more experience with working with this kind of pain. Now, chiropractors with this type of thing won't use necessarily those big, crazy adjustments, especially if you are still pregnant. A lot of times chiropractors like me will use things like a drop table or an activator, which is a little clicker gun, instead of using the big, large movements that cause lots of cracking and popping. You can also look into pelvic support belts during your pregnancy if you are having this kind of pain. These belts help stabilize the pelvis, especially when we have this added laxity during this time period. And they can be beneficial if you have to be on your feet for long periods of time and those sorts of things during your pregnancy or postpartum. Seeing a physiotherapist can also be incredibly helpful, and I highly recommend all of my pregnant and women who have been pregnant in the past to see a pelvic floor physiotherapist specifically. Issues like pubic symphysis pain in the pubic area, or even things like incontinence aren't normal, but they are common and they can be treated, and I highly recommend a good pelvic floor physiotherapist to help you with these sorts of things and also help you to teach specific exercises that can help you going forward. It is also essential to listen to your body. Sometimes rest and activity modification is needed in this time period, especially if you're actively pregnant. I tell a lot of my pregnant patients, the reason you're feeling the way you're feeling or having this pain is because you're pregnant, and we can't change that until the baby's ready to come out. So a lot of the times we do have to alternate how we're doing things and kind of mitigate the pain we're feeling until postpartum, and we can actually address any underlying issues if they're still present. Heat and ice can also be helpful for something like this. It really doesn't matter which one you use unless you have active redness, bruising, or swelling, in those cases I will prefer you use ice. However, the recent studies have shown that heat and ice can pretty much do the same thing for people. It's helping with discomfort. If you are concerned about which one to use, you can also do both and alternate 10 minutes on, 10 minutes off with each of them and kind of flush the area and bring some nice fresh blood flow in. And that can be super helpful in mitigating the pain in the pubic area at this time. Prenatal yoga can also be incredibly helpful. If you find that you are dealing with a lot of tightness and stress in certain areas, trying to find a prenatal yoga class or even trying some stuff online if you're comfortable with that can be helpful. And last, this is specifically for my postpartum mamas. Recovery exercises can be extremely beneficial for something like this. We want to develop and redevelop the strength that we've lost from all of this stretching that's been going on for the last 9 months. So developing a good postpartum exercise regime can be extremely beneficial. However, not going back too soon and not working on bouncing back is key. We're talking about re-engaging our core and our pelvic floor here. This is another reason why seeing a chiropractor or a physiotherapist is really beneficial in your postpartum period, because they can help you determine when you're ready to get back to exercise and what kind of exercise is the best to get back to. Remember, every pregnancy and every body is unique. So what works best for you or for your friend or sister who have had pain like this before might not necessarily work for the next person. Remember, this is meant to be educational, so you can advocate for yourself and search out for the help that you need and the support that you need. Always look out for good healthcare professionals that listen to you and provide you with good care. And if you feel like you're not being listened to, don't be afraid to ask for more help. Experiencing pain like this during your pregnancy can be incredibly difficult. It's not uncommon, and it is manageable. By taking a holistic approach to your well-being and your general health during your pregnancy and after can help manage a lot of these things. That's a wrap on today's video all about pubic symphysis dysfunction. If you have any questions, feel free to drop them below and I can help you either find a chiropractor in your area that you might be looking for, or if you have any suggestions or questions about other videos we might like to do, also leave a comment below and I'll see you in the next video. Bye!